Hi, this is our initial attempt at doing a Facebook Live, so obviously we will give this a whirl, and I would imagine we'll have plenty to improve upon next time. So today's topic is going to be related to cupping. We've gotten a fair amount of questions lately about what is cupping, can it help me, what is it used for, what are the benefits? So we'll try to go over that now. Some other names for cupping can be vacuum therapy or microcirculation therapy. And the background of cupping stems from traditional Chinese medicine. It's something that's been around for a long time, and it's found its way back into some of the massage therapy and acupuncture, some physical therapy, and even some like health and wellness type of environments. It is something that we have been using in the clinic at Impact Physio for a while. We've had some cupping sets for probably the past 4 or 5 years. So it is something that we use, but it's not for everyone. So we'll try to give a description of that today, and hopefully you'll have a better understanding. And if you have any questions, you can certainly let us know. The cups come in different formats. Traditionally, they are glass cups that you would heat up with a flame and then use that to stick on the body part that you're going to work with. The cups that we use are a little bit easier to manage. They are actually plastic. If I can find where that comes up on the camera. So plastic cups and a nice little hand pump so that we can create as much pressure as we need to with that cup. The cups come in different sizes. So this would be a larger cup that we have. And if we needed to work on something smaller, we have some smaller cups as well. So that would be something that we could use interchangeably depending on the size of the body part that we're working with. But also the larger cup is going to get deeper tissue activation. So what exactly happens when we are doing this cupping? There are a couple things. We can leave the cup stationary on the skin, which is more of how it is traditionally done in Chinese medicine. And that is going to give us a microcirculation response. Typically, the tissue is going to turn red. There's often bruising associated with that. And it's a pretty passive kind of treatment. Basically, a person is going to lie there and we're going to put on a couple cups and leave them for 5 or 10 minutes until that tissue gets nice and red. What we're doing there is stimulating an increase in the local blood supply. Typically, normal healthy tissue isn't going to bruise. So if we're doing it in that manner, we're typically doing it with tissue that's not functioning properly, so people often do get bruises. That's not typically how we do it most of the time in the clinic, but that is one application of cupping, and that's probably the most traditional method of doing it. How we typically do it is find an area where there's some tissue restriction. Maybe that can be from some scar tissue, maybe it could be some overuse, some muscle tightness. We use it for a lot of different muscular conditions. And we can apply the cup and we can move it around and kind of use that pressure and suction to mobilize that tissue. And we'll kind of give you an example of what that looks like in a second. We'll do that with my arm. And then the third way that we can utilize the cupping is to put on a couple cups and actually have the patient go through some range of motion. So they can move their body part back and forth while that cup is stationary, and that will also help to kind of mobilize that tissue and free up some range of motion or some inflexibility. As far as who is cupping good for, it really can be for just about anyone. Anyone who has some muscular or soft tissue connective dysfunction or disorders, the cupping is something that can be helpful. The more important thing to know is who's it not appropriate for. So if someone has a blood disorder or an infection or some sort of skin condition, it's not going to be something that we want to do. If someone has some cancer in that area, it's also not going to be something that we're going to do. And if there's a lot of swelling in the tissue, so if it's right after an ankle sprain or something like that, and the area is very swollen, it's really not going to be appropriate to do the cupping at that time. So those are kind of the restrictions. But for the most part, it's something that can be used for most muscular and soft tissue types of conditions. So we'll give you a little example of what the cupping looks like on my arm, and then if anybody has any questions, feel free to post them and we will try to answer them as best we can. So usually we'll use a little bit of cocoa butter to lubricate the surface of the skin, and that allows the cup to actually suction and kind of stick to the skin a little bit better. The cup gets attached to the pump, and then basically we can add a couple pumps, and you'll see that, there we go, camera issues again. We will see that that actually kind of pulls up the skin, and there's a little bubble of tissue underneath there. If we were doing it the traditional way, we would just kind of let that sit. Like I said, that's not the way we typically do it. Most of the time, we're going to kind of move that cup around and try to stretch that tissue out and loosen up as many of those different layers as we can. And we'll just kind of go back and forth and try to work on getting that to loosen up. Typically, there's going to be a little bit of redness involved, but it usually dissipates as soon as we are done. The third application that we can do is having someone actually go through some range of motion and try to move those muscles underneath where that cup is kind of holding the tissue down, and that will help to work on improving the flexibility there as well. So there you have it. In the short run, that's a brief description of cupping and how we use that in the clinic. So if, like I said, you have any questions or anything specific you'd like to know, just shoot us a message and we'll be happy to answer. I hope everyone has a great night, and we'll look forward to doing this again next week with another topic. So also in the comments, leave a question or a topic that you'd like to see us cover.